Thank you very much. It is always a great pleasure to be with you all and to share our experience. So what I will be trying to speak on is about the work we are doing in Bangladesh on disability inclusive disaster risk reduction, very briefly. So I'm going to try to share my screen and hopefully it is going to come on. Are you able to see it?
Yes.
Okay, great. So as I said, Bangladesh, so we are a small country of around 170 million people. And if you look in terms of persons with disabilities, so if you take with the figures that we have with the household income and economic survey at almost 7%, so that's close to 12 million. And if we go by 15.6%, so 26 million people with disabilities in the country. So, disaster is very common in Bangladesh. So my cover photo, I have an image of a couple affected by flood who has raised their bed with rope in a bamboo and trying to live there. So basically the people of the country gained a lot of coping capacity, how to respond when there is a disaster. So as I said, Bangladesh, due to our geographical location, we have a varied range of crises and hazards, whether it's, river erosion, flash floods, or slow floods, drought, cyclones, and even the recent crisis of, refugees. So these are all quite common in the country. And with, as I said, people with disabilities are a significant number in terms of population, but they are disproportionately more at risk and not as much still participating and being included in the overall DRR process. This is something which we are trying collectively to address. So as I was overhearing, it's really important to work with all stakeholders when you're working on disability inclusion in DRR. And the starting point that we have is to, wherever we are going to start the work, is to have the community consultation. So there are images of people coming together and discussing, okay, what are our risks in this community? What are the different hazards? What capacities do we have? And where there are people with disabilities, women, older people, other at-risk groups are participating and sharing their opinion. And based on that, for that particular community, we are designing what could be a risk reduction action plan? What do we do that would strengthen our capacity in the community? And as one of that process to do is that to really invest in strengthening capacity, acknowledging the fact that local people, on the ground, they do have their knowledge. So how could we bank on that and strengthen further? And it's not only at the local level, at the community, with the different committees, with the local government, but also at the national level, where are the policymakers who are thinking about DRR, the different larger actors, civil society, to be aware, sensitize, and strengthen capacity on how to do it. So at one level, people with disabilities, their groups would need to know, okay, what is DRR? So what are our entry points? How do I influence the DRR actors in the community? And at the same time, for the DRR and the government and other development actors, how do I do the disability inclusion? So there's a number of training programs that we do. As I said, awareness raising is key. Having that positive attitude towards disability as a whole, and then also to understand about the importance of DRR and how it can be included. So with regard to raising community awareness, the There are different ways, and I have two images here. One is the theater in the community and or folk media. And in these theater groups, there are persons with disabilities who are giving the messages along with other performers in their community. And mock drill is very important for the community to really put into practice in trial and be ready, so that when the real situation arises, they know how to what to do and how to address. And then there's other ways we are also doing community level awareness to sensitize the people. Again, within DRR, early warning is a key component, and with different hazards, whether it's flood or it's cyclone. So how can these early warning that we have now can be inclusive? How could we make these messages reach to the people with disabilities and their families with adequate lead time so that they can move, they can understand, and then they can move to the shelter when it is required, as well as the different rescue mechanism that exist in the community, as well with the government, to make sure those rescue mechanisms, evacuation mechanisms are also inclusive of persons with disabilities. This is just one example, which I am showing. It's an accessible rescue boat that was piloted in one of the flood-prone areas, and which is for not only for persons with disabilities, but for the whole community. So this rescue boat could reach to a particular flooded community, be there, get people with disabilities, older people, and evacuate them to the higher ground or shelter. At the same time, support the community with their assets and transform that. Now, there's a good news with that I will share towards the end, but this was really effective, and it's the persons with disabilities and local community managing that. One of the key components of our work on DRR, DIDRR, is the engagement of persons with disabilities. When I said engagement, it's not only they're being present, but them taking a contributive role, not only for persons with disabilities, but for the whole community. So strengthening their capacity, giving them that space so that they can really contribute, and that is really happening if you give time and have the support mechanism. And also from among the persons with disabilities, they are champions who can really encourage and motivate and inspire not only other persons with disabilities, but the community as a whole also look up to them. So this is also growing. It's really important. And then for persons with disabilities, self-help groups, and the inclusive disaster management committees to really play an active role and demonstrate the contribution they can make. Here, I'm showing two images where these committee members and self-help group members are supporting their community in repairing the embankment or the pathway and or building a ramp with local materials. So this is how they're contributing. Then also as in the rescue boat, which I have shown, where a person with disabilities are warning the whole community and also identifying where people are stuck and need to be rescued. So there's many ways persons with disabilities are contributing and playing an active role, not only as recipients. Here, after a disaster, so these groups of persons with disabilities, they are managing a relief mechanism. So since they were already prepared, they were also active in terms of humanitarian actions. And it's not only for persons with disabilities, but they're doing it for the whole community. We all know about the COVID-19. So they were also engaged, providing hygiene materials, and also cash support, then giving the information about how can we be safe from COVID. We can try to be safe from COVID. All those, it was the groups of persons with disabilities playing that active role in the community. And in Bangladesh, like in other countries, you would have first responders, both at the local level. In our country for cyclone, we have the CPP, cyclone preparedness, volunteers, and also at the national level, there's the civil defense, there are scouts. So we do a lot of engagement with them because they will be at the site first along with the community, so that they receive the training on how to do an inclusive rescue, and so that they can really be supporting. At the urban level also, it's not only the rural areas, urban DIDRR work is also there, where the focus for Bangladesh and us is more on earthquake and fire. So again, this training, doing the mock drill, sensitization, awareness, and people with disabilities in the lead. And I'm almost close to my presentation. And with all of this, advocacy is really key. Doing the influencing with evidence, and working with the government at different level, and the Ministry of Disaster Management in Bangladesh, you'll be happy to hear, are really proactive and very positive about inclusion, and they're virtually taking a lead. I think many of us would recall about the Dhaka Conference on Disability and Disaster Risk Management and the Dhaka Declaration. So several things are happening, like in the policy, disability issue is being included in the standing order on disaster. There is circulars that persons with disabilities has to be in different committees. The cycle shelters need to be, made accessible. Training packages have been developed by the government, which now they are offering to their, staff members, volunteers on disability inclusion. Now, at certain part of my presentation, I was saying about the good news. So that accessible boat that I had shown, which was piloted, you can also see in this image, which was piloted there in one of the flood-prone area. So I'm showing another image with a series of boats. So the government have taken up this decision that they are going to build this type of boat and fund it for its operation. And 60 such boats have been already ordered, and a number of those have been completed and is now serving the country, and in terms of rescuing people with disabilities, older people, along with other committee members. So I'd like to end by thanking and emphasizing that if we are thinking about DRR, it's really important to think about the awareness and sensitization, then telling people how to do it, and strengthening the capacity so that that can be done, and through that process generate the evidence for advocacy, engaging with the government and other stakeholders for replication and scaling up. And what is really important that, it has to be like all together for all, with persons with disabilities really in the forefront, in contributive role, I think, which is extremely important, and which we are trying to do along with our colleagues with disabilities in Bangladesh. Thank you very much. Sorry if I have taken more than 10 minutes.